Well, hello all. Welcome to the Got Hair Show. I'm Dr. John McCrae. I'm a hair restoration specialist practicing out of the Boise, Idaho area. And today we're going to talk about microneedling. There's been a lot of questions that come into my practice on a daily basis about microneedling, and we're seeing more and more of it on social media. So I wanted to explain how microneedling works, or does it work, or what can you expect with microneedling. So I've drawn out what a hair follicle looks like over here. So this is a hair follicle, and the hair follicle is a tiny little organelle that lives in the skin, okay? And what I've drawn here is if we were to dissect the skin, what that would look like. And the top part here, this is called the epidermis. This is the outside of your skin. It's what kind of fluffs off. It's about 1 millimeter thick. And as we go down, the purple part is the follicle. And a lot of people confuse a follicle with that little bulb at the end of a hair, like when a hair comes out. That's not the follicle. That's actually called the bulb. The follicle lives in the skin, and it never comes out of your skin unless you actually excise it out of the skin. So the purple part is the follicle. And there's a group of cells that are really important on the follicle called the bulb cells. And that's these little purple dots that we got going on here. Those are stem cells that make the follicle grow. Okay, and so when the hair sheds about every 3 to 6 years, during the shedding process, those bulb cells get active, and they make the follicle grow back to the size it was before the shedding. Okay, and those are the important cells that treatments such as microneedling affect. Is that group of cells? We want those cells to be healthy. Healthy cells there equals healthy hair follicle. So the red part of this is the blood. So once we get from the epidermis into the dermis, which is about 1.5 millimeters down into the skin layer, we get into the blood supply, okay? And blood obviously is nourishing the skin. It's making everything healthy. And so that's what the blood supply is doing, okay? So how do we make a hair follicle healthier? Healthy hair follicle equals healthy hair, okay? Sickly hair follicle makes a sickly hair. We want big, thick, robust hairs. We don't want these thin little guys, okay? So let's say we have a situation where you're going through male pattern baldness, okay? And male pattern baldness is a process where a big hair over time gets smaller and smaller and eventually becomes peach fuzz, okay? And if we can catch that degradation of the hair before it's lost 50% of its diameter, then we can bring it back. So what would that hair shaft look like? A sickly hair shaft could be right next to a healthy one on a hair, and it would look something like this, okay? It would be a little less robust, okay? And it would be thinner, okay? And it wouldn't be as long. And a lot of times it's not even the same color. So if you're a dark-haired individual, a lot of times these will come in as like blonde hairs, okay? So right next to a healthy hair, we have a sickly hair. So where does treatments like microneedling come into place? One of the problems with these sickly hairs is these little bulb cells that we have right here aren't getting the blood supply they need. Dihydrotestosterone negatively affects the blood supply to the scalp. Okay, and so one of the things we can do is we can increase the blood supply to the scalp. And microneedling is a mechanism used to increase the blood supply to the scalp. So how does microneedling increase the blood supply to the scalp? Microneedling is a action where a needle pokes a hole into the skin. What happens when you poke a hole into the skin? You cause some damage. And the body knows there's a wound. And when the body knows there's a wound, the body needs to repair the wound. How does the body repair a wound? So let's imagine we take a knife and we do a little nick on our arm. First thing that's going to happen is that nick's going to bleed, right? And it's going to bleed, bleed, bleed. And around 5 to 8 minutes, it's going to start clotting off. And what happens during the clotting process is platelets, which are a component of your blood, flood the area. They form a fibrin matrix. Fibrin is like sticky glue, and they clog that wound. And during that process, growth factors are released, signaling wound heal. We got a wound here, we need to heal. And then what happens is we start a wound healing cascade. From that action, white blood cells and stem cells flood the area and they start to repair the damage. There's a specific type of stem cell called a fibroblast that will come in and make collagen to repair the wound. And the other thing that happens is the body knows that the blood supply has been interrupted and it needs to fix the interrupted blood supply. So what does it do? It grows more blood cells. So that area that the wound happened, the blood supply is no longer valid, and the tissue kind of starves for oxygen a little bit, and then the body responds by growing more blood supply, which is why after a wound, when you look at it, it'll be red for weeks to months later, because it will overgrow the blood supply. And then after a while, the body's like, why do I have so much blood supply here? We don't need this much blood. And this big ball of blood supply that you got from the wound will go back into a normal pattern. So what does microneedling do? We cause that wound. And when we cause that wound, we get something called angiogenesis, creation of new blood supply. Okay, so angiogenesis happens. The blood vessels overgrow the area, and we increase the blood supply to the scalp in a semi-permanent manner. There's other ways of increasing blood supply to the scalp, like through medications and stuff. We're not going to talk about those in this today. But microneedling grows a new blood supply, and when you grow a new blood supply, it sticks around for a while. So what do? We come in, we poke a bunch of holes in the scalp, right? And we cause damage. So the microneedling device will come in and poke holes. Okay, and then blood comes out. Okay, and then it starts sending out its signals. And then what we end up happening is an increase of blood vasculature. Okay, increased blood supply, increased nutrients to the bulge cells, follicular health. Okay, and we have a protocol we do. We'll do a microneedling session about once a month for 3 months, and then depending on your situation, we'll see you about every 3 months to 6 months after that to continue that process. Think about it like hitting the gym. You know, let's use Arnold Schwarzenegger as an example. Arnold Schwarzenegger looks like me. He doesn't have a lot of muscles. He goes and hits the gym really hard for 3 months. Okay. At the end of that 3 months, he leaves looking like Arnold Schwarzenegger, big old muscles. Okay. And he's like, you know what? I'm not going to work out for a while. Do the muscles go away the next day? No, they're going to stay for quite some time. Okay. So a month goes by, he looks pretty much the same, but eventually the body's like, hey, you're not using these muscles. We don't need to maintain that with all the nutrients, right? And the muscles start to shrink. Okay. And when they start to shrink, Arnold goes back to the gym for a month, works out again, gets them big, stops working out. Time goes by, they start to shrink. Okay. Then he goes back to the gym a few months later, gets big again. Same process with microneedling, except instead of muscles, we're growing blood supply. So we'll get you on a treatment for about 3 months, or a treatment a month for 3 months, get a bunch of blood supply in there. And then as that blood starts to wane, we hit you again. And then it'll wane and we'll hit you again. And we just keep that blood supply going. Now, if you wait an extended period of time, let's call it a year, you'll go back to normal. You'll have to do 3 treatments again to get there. Okay, so that's the science behind microneedling and how it works. Now, oftentimes patients will buy microneedling devices on like Amazon and stuff like that, which isn't necessarily a bad thing if they're the right device. Microneedling devices come in different size. You've got 1/4 of a millimeter depth, you've got a millimeter depth, all the way to 4 millimeters of depth, okay? What you're looking for, and I don't recommend you do microneedling on your own, because you need a medical grade microneedling device. And a medical grade microneedling device goes deep. How deep do you need to go? To where you draw blood, because that's where the blood supply are. Remember, this is 1 millimeter, okay? Any microneedling device less than 1 millimeter isn't doing you any good. All it's doing is exfoliating the scalp, okay? The bulge cells are 2 to 4 millimeters deep. Okay, so you've got to be 2 to 4 millimeters deep because this is the area we want that blood supply, right? A 2 millimeter long needle barely gets into the dermis. It'll get to right about here. A 4 millimeter will get right about to there, okay? You are not going to be able to tolerate a 2 to 4 millimeter microneedling device without some sort of anesthetic or some sort of professional doing it in the practice. So I don't recommend you buy a 2 millimeter long needle and do it yourself. It's really painful and it really hurts. There's ways we can get around that in the practice, okay? But that's microneedling in a nutshell, okay? The other thing, if you're doing it this home, the hair, very dirty, lots of microorganisms in it, okay? On every one of these follicles is often sweat glands, and sweat glands are full of bacteria. And you start poking through these bacteria, you're going to get yourself little acne blebs and little infections and stuff like that. So you really do need to get microneedling done by a hair professional. So anyways, that's how microneedling works. It does reverse miniaturization of the follicle. We take these little guys back to these guys. Now, one last thing before you go. This is not an overnight treatment. We're growing new hair. Okay. It takes years to see final results. Okay. We have to catch the hair in the shedding cycle, which only happens every 3 to 6 years. That's the phase where these hairs are going to get benefit from microneedling. So you have to commit to this race. It is a marathon race, and you will not see results after 2-3 miles. You got to run the full 26 miles. And maybe in 3 years, we go from this to this. And then we got to wait another 3 to 6 years to go from this to this. So it is a gradual improvement of the hair. It is not an overnight fix. There's nothing in hair restoration that's overnight. Okay. So that's how microneedling works. If you are suffering from male pattern baldness or any kind of other alopecia, I will often see benefits from doing a treatment such as microneedling. So I hope that helped you learn a little bit about microneedling. If you want to talk more about that, you can reach out to me at my practice and we can get you where you want to be. Thanks.